Hey guys, can you see me? Can you hear me? Hello, hi. I hope I'm audible and visible. Welcome back, everyone. Just give me a second. Okay. Can you guys see me? Can you guys hear me? Hello, everyone. Very good evening. Hope you're doing good. If so, say me a hello, hi. I'm expecting few routine people to be here. Yeah, good evening, Lion. Good evening, Lilith. So, Mera. Okay, great. So, like what we discussed in the last class, we are going to go with few MCQs today. So I have taken the predominant MCQs from the DPP, which happens after post class in every live class in your essentials batch. That's the main thing here. And also I've added few clinical scenario based questions because if one liners alone might not be enough, we'll try to apply whatever concepts we read and try to solve clinical scenario questions as well, right? So yesterday we had a third year batch launch. That time quite a few students said that the PPT was not visible. So for the sake of them, that these were the offers available. Good evening, Swati. मैं बढ़िया हूँ ललित. Okay. I hope my Hindi is right, right? So these were the students who wanted to know that what is the offer for the third year batch, the Sushruta batch, right? So just to go through it, these are the offers which are available. And if you're intern post student, go with the ASAP combo, right? So let's start today's class. I'll say a question like this. I want you guys to answer whatever comes to mind, give the right answer. Then we'll discuss about it quickly, right? Our target is somewhere around 15 questions. We'll try to solve, and hopefully we will do the same thing tomorrow also. And let's see if we can learn together. Thank you. What's the answer? Okay, now I get started with B. And everyone here, comment whatever comes to mind, right, wrong. It's not important at all. Okay. Okay. So most of you have answered B, 3 of you only, but I want everyone here to comment. It's fine if you make a mistake, it's fine, ignore it, right? Perfect. So the question is, what is the process of hypertrophy? So hypertrophy, the main concern for everyone knows is an increase in the protein synthesis, right? I'll add one older PYQ was there. That option was increase in the DNA content. Is this right statement or wrong statement? This is one of the options in the PYQ, older PYQ. Increase in DNA content in hypertrophy, right or wrong? The DNA content will not change. The active part of DNA will become more, right? That's why we have gene activation, protein synthesis, and organelle production, right? So this is not right, right? This is wrong. I won't have increased DNA content. Can I say if the option has increased RNA content, will that be right statement? Sure, sure, Lalit. Yes, RNA content will be a right answer, right? So RNA content will be elevated, DNA content will not be elevated. Like the option B says, gene activation will be there, protein synthesis will be there, organelle production will obviously be there, right? Just we'll quickly recap hypertrophy. I'll ask you a few questions regarding hypertrophy. I want you guys to answer one by one. Can hypertrophy, a prolonged hypertrophy, cause cancer? Yes or no? Just simple statement to quickly revise hypertrophy. Will hypertrophy prolong cause cancer? Perfect. They will not cause cancer, right? Amazing, right? Hypertrophy happens in smooth muscle and skeletal muscle, or both smooth muscle, skeletal muscle, or none of them. Hypertrophy happens only in skeletal muscle, or only in smooth muscle, or both of them. It can happen in both smooth muscle and skeletal muscle, right? Perfect, right? Great, fine. Cardiac hypertrophy. If I have a question saying that there is an eccentric cardiac hypertrophy of the left ventricle, what is the pathogenesis? Hypertension or aortic regurgitation? Good evening, Shreya. It can happen in both, though we concentrate only on the skeletal muscle. For whoever answers skeletal muscle, I'll give you an example. Uterine smooth muscle will undergo hypertrophy in pregnancy, right? That's the question, right? Perfect. It happens in volume overload, eccentric, and classically seen in aortic regurgitation, right? Great. Let's go to the next question. Again, I want you guys to comment on the right answer. Whatever comes to your mind. This is also a very old PYQ. If you attended the essential past class, I have told that is not required, but still, older PYQs, we have to get used to it. When does hyperplasia and hypertrophy generally happen together? Okay, Lion started, Nayak started, everyone else. 20 plus online. We need more answers, right? Deepak, great. Radha Krishna Science. Great. Right? Perfect. Both hyperplasia and hypertrophy happens in uterus during pregnancy. That's why I gave an example in the previous question. Smooth muscle hyperplasia as well as hypertrophy can happen. Just a leading question. Can skeletal muscle undergo hyperplasia or no? What do you think? Skeletal muscle, can they have hyperplasia? Can skeletal muscles have hyperplasia? Perfect, right? Skeletal muscles cannot have hyperplasia, or in other words, there's a second option here. Can a permanent tissue undergo hyperplasia? No, right? There'll be no hyperplasia in case of a permanent tissue. Only a dividing tissue can undergo hyperplasia. In other words, skeletal muscle and neurons, CNS, cannot undergo hyperplasia. Maximum hypertrophy, otherwise they'll dead. That's all, right? Again, this is a very older MCQ. There's one more place where hyperplasia and hypertrophy can happen together. Can anyone give me one more example apart from uterus where hyperplasia and hypertrophy can happen together? Hyperplasia and hypertrophy together. Again, clinically it's not important for me, but it's might come, right? Perfect. In breast, right? Great. So in breast, what happens in breast parenchyma, especially due to lactation, right? So during lactation, both of them can happen. I'll have more of breast parenchymal, the fat can become more. At the same time, I'll have hyperplasia of the glands because of the prolactin hormone, which helps in the milk secretion always, right? Perfect. Great. Next question. Read through the question, look at the image carefully and write the answer. I'll keep myself quiet for next 15 to 20 seconds. Go ahead. What's the answer? Okay, Naik has said with D. Lion has gone with B. Okay, Shreya has gone with D. Okay, Radhakrishnan says has gone with C. Okay, Dash with D. Okay, great. Jyoti Dash with D. Fine. Perfect. So let's see. Let's see what will be the right answer now. See, when I gave a very simple question, most of you guys answer, right? Same question, I'm changing the words. That's all. Please do remember, be it USMLE exam or a PLAB exam or an Australian exam or an INICT or NEET PG. If it's a scenario based question, first, don't get worried. Second thing, don't look at the image. If it's an image based question, right? We'll ignore this image. I'll just go with the history. You tell me what will be the answer. A 45-year-old, ignore Afro-American, not important for me, has a long-standing hypertension and who died of stroke. What organ is this? Can anyone tell me what organ is this? Can I say it's heart? It's definitely heart, right? So what do you think will happen to heart in case of a long-standing hypertension? Hypertension and heart, what happens? It's simple, right? You have hypertrophy, that's all. So what made you go with the wrong answer is overthinking, that's all, right? Cardiac hypertrophy is seen in hypertension. Same thing here, my answer is hypertrophy. Heart will not undergo hyperplasia. You know that, I know that, right? It's never aplasia. What does aplasia mean? Aplasia is congenital absence. Heart cannot be absent, right? At birth cannot never be absent for a person to live, right? Atrophy, again, is impossible to have an atrophy because if you look at this heart, we'll see if it's possible to extrapolate from the image. Can I say this left ventricle, whatever I have, if you look at the chamber, can I say this left ventricle chamber is very small or very big? You must have seen a normal heart. You must have. This left ventricle is small or big? Extremely small, right? It's a smaller left ventricle lumen. In other words, I'm having a very thick muscle. So I have a very thick muscle which is making the lumen extremely small. So it's nothing but an example of cardiac hypertrophy in a long-standing hypertension. The patient died with a stroke. It's an extra finding here, that's all, right? So the question is on the heart muscle, there's nothing but a simple hypertrophy. Scenario-based questions must be easier. Next time while answering the scenario-based question, read the question once or twice. It's fine. You need not be the first one to give the answer. Just be the right one, right? So you always been given a wrong thing, right? We always want to be first. You have to be right. That's more than enough. Attend this question. Read carefully. It's fine if your friends answer. Let's see. It's easy, Lalit. It's difficult only in the head. Process it. It's very simple. I have absolute confidence in everyone here. You can do it. Perfect. Amazing. Great. Right. So what is the mechanism responsible for cell atrophy or reduction in the cell size, right? Extracellular enhanced cellular proliferation. Which of the cellular adaptation will you think option will be A? Tell any cellular adaptation like hyperplasia, hypertrophy, metaplasia, atrophy. Which will have option A? Because this question is very simple. We'll go the other route. Enhanced cellular proliferation will be seen in patient with hyperplasia. Perfect, right? So here, increased hormonal stimulation will result in which of the cellular adaptation? We're same for adaptation: hyperplasia, hypertrophy, metaplasia, atrophy. This also is hyperplasia, right? So both of them, the cellular adaptation is going to be hyperplasia. Your example, your endometrium proliferation, everything is in hyperplasia, right? Perfect, right? The ubiquitin proteasome pathway, that's the classical finding seen in atrophy, right? I'm just going to ask you one more thing. Let's say in this question, option C is apoptosis. Okay, I'm just changing option C as apoptosis. Can I say option C, if it's apoptosis, both B and C can cause atrophy? Yes or no? Again, whatever comes to mind, answer. Can apoptosis be an example in atrophy? Yes or no? Perfect. Yes, right. Please remember, atrophy has two mechanisms of death. One is your ubiquitin proteasome degradation, right? One is your proteasome degradation or your proteasome pathway or your lysosomal autophagy, and the other one is apoptosis. Okay, this is important. Apoptosis is not the majority one, but that happens, right? The reason why I want you to remember this is, if apoptosis is going to cause atrophy, is it a reversible process or an irreversible process also? Or only reversible or irreversible also? Apoptosis is cell death, right? Cell death, that make it irreversible as well. The cell dies, it's gone, right? So atrophy is both reversible and irreversible because atrophy has both proteasome mediated autophagy and apoptosis, which makes it irreversible, right? Perfect. Amazing. So since many of you guys answered, just one more extra question. Tell me one example of irreversible apoptosis apart from your postmenopausal endometrium. Because I have told that in the class, I'm sure you'll remember. Apart from postmenopausal endometrium, give me one example of irreversible atrophy. Okay, lion has gone with thymus. Anyone else? In other words, thymus is the right answer, extremely right answer. Ovarian apoptotic follicle, thymus is an extremely right answer. See, if something outside ordinary comes, everyone answers thymus, right? I'm just going to extrapolate to something else. Can I say almost every embryological disappearing things are irreversible? Thymus, Meckel's diverticulum, thyroglossal tract, notochord, everything, right? So everything which is embryological are irreversible, and if it's physiological after birth, your endometrial atrophy is irreversible, right? Perfect. Next question. It's a very simple question. I hope everyone will give the right answer. 10 seconds for this question. It's a very simple question. I'm not going to take much of time here. Meta means change, that's all, right? So it's change in one cell type in response to stress is your metaplasia, right? Medicine Explorer, I hope you wanted to answer option D. It's option D, not option A. Can anyone tell me what's the mechanism of metaplasia? The mechanism of metaplasia. Mechanism of metaplasia is you have to reprogram the stem cell, right? Reprogramming of stem cell is a classical mechanism which is seen in patient with metaplasia, right? Perfect, great. It's a very simple question, right? So once you have a simple question, next question is going to be a scenario based question. So now itself I'm telling you, read through the correct answer, read through the entire question. It's fine. Hide the comment box. You don't want your friends to answer, right? Hide the comment box, read for it. I will not talk for the next 25 seconds. It's for you. Give the right answer. That's enough for me, right? Go ahead. Great. You won't believe the amount of time I kept quiet. I didn't say anything, was just 20 seconds. That's all. 20 seconds is such huge thing, right? So in the 20 seconds, you can easily read the question more than once. You guys are good. It's not difficult. Lalit, I hope this question is easy for you, right? Right? It's perfect. It's very, very simple question. The question says, I have a patient with HIV/AIDS and also the patient had pulmonary tuberculosis. What type of necrosis is found in the granulomatous lesion, which is characteristically seen in this patient, which is also a frequent complication of AIDS, right? Perfect. That's all. It's pulmonary tuberculosis and granuloma has to be only one thing. It's caseous necrosis, right? Every case of tuberculosis, be it with HIV or without HIV, the finding for me is going to be granuloma. And in granuloma, the necrosis, what I see in tuberculosis, caseous necrosis, right? It's a very simple question. Bigger question stems are not difficult. Start it from now. Keep in mind, it's not difficult. So once you get it sorted, it's definitely not difficult. It's very, very simple, right? Next, one more easy question. Read through the question, give the right answer. Great. It's a potential consequence of a persistent stress in metaplasia, right? If the stress is very, very persistent, very, very consistent, obviously one of the complications for us is progression to dysplasia and a cancer, right? Two leading questions I want you guys to answer. In case of a patient with Barrett's esophagus, what cancer will it become? Squamous, adeno, neuroendocrine, or sarcoma? It become adenocarcinoma. Perfect. In case of metaplasia with respect to your respiratory tract, okay, respiratory tract, what will happen? Squamous, adeno, your sarcoma, or a new carcinoid? Now I'll come to your question. So it'll become squamous cell carcinoma, right? Next question. In case of myositis ossificans, which is also a type of metaplasia, what cancer will it cause? Let's see how many of you answer this. Keep this in mind. In case of myositis ossificans, okay, amazing, great. Make a mistake. Only when you make a mistake, you will learn. Well, it's completely fine to make a mistake. Myositis ossificans will not result in a cancer, right? So what happens is, for every metaplasia to become cancer, there should be a recurrent stress again and again and again, right? So in myositis ossificans, there's a broken limb. That's the first stress. Do you think limb keeps on breaking again and again the same way, like GERD or like smoking? It will not happen, right? It's unlikely for it to happen, right? So myositis ossificans, there is no progression to a cancer. They don't progress to a cancer because in myositis ossificans, the stress is not repeated. It's once in a while, right? It's once in a while, so it will not cause a cancer, right? Now coming back to question, it's a very good question. HIV/AIDS patients, am I right in saying that a patient with an HIV/AIDS can have CD4 count of above 1000 as well as below 100? Can I have the variation? I can, right? Some of the HIV patients might not have any symptom, have a very good CD4 count, right? So during that time, yes, I'll have a little bit of immunity. That kind of is going to cause necrosis, right? So only when the CD4 count drops a lot, that's a time when you might have less immunity and might not have granuloma or necrosis, right? Read the next question, comment on the answer. Again, it might look big. It's very simple. Everyone online attempted. It's fine to make a mistake. Namrata started with option A. A, great. Very simple, right? If you read through the question, what I want you to do is, for any scenario-based question, I want you to pick up the keywords. In this keyword, 40-year-old, the first keyword for me is lupus. Options, look at the options. Lupus necrosis, that's more than enough for us, right? That's my first keyword. Second, vasculitis, second keyword. Third, vessel wall necrosis, right? Skin vessels, that's all. Vessel wall necrosis is fibrinoid necrosis, right? There's an approach called as a retrograde approach of solving a question. For a scenario-based question, what I want you to do going forward is try to practice from now. First, look at the options quickly. So you know that here option is about necrosis, right? 4 different types of necrosis, right? So now you go to the top, your mind will automatically pick up the keyword which will be relevant to the options. If you just read without a keyword, without what I'm going to look for, you might miss some time, right? So do retrospectively, it's much easier for you. Necrosis, lupus, fibrinoid, right? We go the causes, SLE, lupus is the cause, right? Systemic lupus erythematosus is a type of vasculitis which causes fibrinoid necrosis, right? Perfect. Next question. Write the correct answer. Come to the correct answer. What's the right answer? Yes, Priya. Type 3 hypersensitivity. Okay, it's a very simple one, right? So what happens is vitamin A is a molecule which helps in maturation. As a molecule helps in maturation. So here maturation is defective or abnormal. So what happens is you start having keratinizing epithelium. If you remember histology, the conjunctival area will have little bit of mucus cells also. That's why it produces kind of tear film. If it's keratin coming on the top, do you think tear will flow outside? Yes or no? Right? So it becomes keratinized. If it's keratinized, do you think there'll be tear flow? No, there'll be less tear because all the mucus glands will be replaced. I will not have good amount of tear. If tear is not there, the eye will it become dry or not? It becomes very dry, right? That's what you must have read in your biochemistry vitamin A deficiency, xerophthalmia. Zero is dry, right? You must have definitely heard about xerophthalmia, xerosis. Everything is a sign of vitamin A deficiency, right? And this stratified keratinase epithelium is going to be very, very dry compared to the rest of the conjunctiva. So that can be easily seen as Bitot spots. Have you read about Bitot spots in your biochemistry? You must have. So Bitot spots are nothing but keratinized squamous epithelium seen in the conjunctiva. That's what Bitot spot is. And all of these are signs of vitamin A deficiency. Remember this. If you're not added this in the note, added this to your note. Vitamin A function is maturation. So can I say if vitamin A is deficient, maturation is not normal? Is that statement right? It is right. Perfect. So can I also say if vitamin A is excess, again my thing is not normal, maturation is not normal? Yes. So vitamin A, both deficiency or if there's an excess, it will result in metaplasia. It's not just deficiency, vitamin A deficiency as well as excess causes metaplasia. Please remember this. Add this to your notes if you're not known this before. Fine. Okay. Read the question carefully. Okay, I was saying, I hope my voice is audible now. I was saying vitamin A alone, both excess and deficiency can cause metaplasia. Fine. Read the question carefully. Try the retrograde approach. See if it works. Answer. Okay, B. B. Lion has gone for D. Hypertrophy. Okay, we got two different types of answer, right? Right. Okay, let's read through the question. It's a 45-year-old female investigated for hypertension and is found to have an enlarged left kidney and the right kidney is smaller than normal. Right? There are two things here happening. One is bigger, one is smaller. Contrast study reveals there's a stenosis of the right kidney. The question is very simple. The size change in the right kidney is an example of, right? So when the question is asking about change in the right kidney, see what's happening to the right kidney. Right kidney is becoming smaller. There's only two places here where I can have small kidney or absent kidney, aplasia or atrophy. Right? Aplasia unlikely because there's no absent kidney. I have a kidney. Now the kidney is smaller in size, which is the only answer, right? It's perfectly atrophy. If I change this question and say, tell me what is the change which is happening to the left kidney, what will be the answer? Can anyone tell me? If I change the question, left kidney, the answer will change to D, right? Hypertrophy. Perfect, right? Perfect. So in left kidney, I'm having a compensatory hypertrophy because the kidney becomes bigger in size because the right side kidney is affected, right? So again, don't expect the same question to come in an exam. Every question has two possibilities, this or that, right? So keep in mind, read through the question carefully. Same question comes, amazing. If something changes, you should not get stumped, right? It's simple. In one, there's a blockage, so atrophy. Other one is having a compensatory hypertrophy. That's all fine. Next question. Let's see. Read through the question carefully. It's fine. Don't be in a hurry. Slow and steady. And right there. Tell me the right answer. Perfect. It's a very simple question, right? 30-year-old person diagnosed to have cerebral infarction. Again, if you have read retrogradely, if you have seen the option once, cerebral infarct, brain infarct, you know the answer. You will automatically search for liquefaction necrosis, right? That's the advantage of going retrograde, right? So look at the option. So I know that instead of having an option of entire medicine or pathology, my things narrows down to necrosis alone, right? Cerebral infarction, liquefaction necrosis. This stuff is not required for me. Let's say that this proteolytic enzymes, microglial cells, will going to contribute to the liquefaction of the brain tissue. It's obviously liquefaction necrosis, right? Can anyone tell me one more example of liquefaction necrosis apart from pancreatitis? That I'm sure you know. Any other thing apart from pancreatitis? Example for liquefaction necrosis? Any abscess formation is liquefaction necrosis, right? Perfect. Next question. Read the question, tell me the right answer. Slow and steady, need not be in a hurry at all. Very simple one. Okay. A 6-year-old radiologically has an abdomen imaging was done and is found to have only one kidney. And she doesn't even know that having one kidney because the other kidney is taking care of the job. Which is the following term best explains the situation? Perfect. The answer is agenesis or an aplasia. The kidney is not even formed because only one kidney is there, right? I'll ask you a different question. Same patient, what adaptation would have happened in the kidney which is present? One is absent. What adaptation happens in the kidney which the girl has? Perfect. Hypertrophy. Because one is absent, the second one will have compensatory hypertrophy, right? So I won't call it atrophy, Swati, because atrophy is an acquired phenomenon. This is agenesis. It's not even formed. The other kidney will have compensatory hypertrophy. Perfect, right? One more question. Read this. Might look big. Again, go retrograde. Look at the options first, then go to the question. It will make your life much simpler. Nayak, Lioness, one with C, anyone else? It's a simple question, right? It's a very simple one. If you've gone retrogradely, I'm having options of coagulative, liquefactive, caseous, fat necrosis. With this idea, I go and read the question. 45-year-old, history of hypertension, presents with severe pain and shortness of breath. Chest pain, hypertension, shortness of breath, and these are the ECG findings. You learn about ECG findings of MI when you go to medicine. So it's a classical case of myocardial infarction. Goes to emergency, thrombus is there, everything is there. What will happen to the affected myocardium, right? Any solid organ infarct will have this. Ayush, coagulative necrosis happens in any solid organ infarct. The mechanism is protein degradation. Liquefactive necrosis happens in brain infarct, acute pancreatitis, or an abscess formation where the mechanism of action is enzyme activation. When the enzyme gets activated, the entire structure becomes liquefied. So we call it liquefactive necrosis, right? That's it. Okay. Last question of today. Again, a very simple one. This was a question from DPP. If you've been in the essential batch, you will definitely get DPP every day. So it increases your problem solving skills. Characteristic of apoptosis. Apoptosis will have reduction in cell size. So option A is wrong. Again, apoptosis will have reduction in cell size. Option B is also wrong. The nucleus in apoptosis will be shrunken and will become pycnotic or condensed chromata, right? So this is the right option. A shrinkage of cell with eosinophilic cytoplasm with a blue color, dark blue nuclei. That's a classical finding for apoptosis, right? Okay. That's all with today's question. We have seen 15 questions. We'll cover 15 more questions in the next class with the rest of general pathology, the first chapter, apoptosis, intracellular accumulation, and all aging and everything, right? Lion, aortic regurgitation is where the aorta is not able to close the blood. After the systole, it's not able to close. It regurgitates. Dissection means the aorta is getting torn. It's being torn. That's a different disease. This is a different disease, right? Okay. So great. Thank you. See you in the next class. Till then, bye-bye. Keep solving more and more questions. MCQs are the easiest one. More you solve, the better you become. Fine. Bye-bye. See you.